Phoenix Children's is officially out of network for Blue Cross Blue Shield, the two unable to reach an agreement through negotiations. 12 News journalist Colleen Sikora following up on where things stand now.
No deal.
They're not looking at patient care. They're looking at money, which is terrible.
No clear path forward for Shelly Harmon's son, Braxton.
Braxton has 16 doctors that he sees at PCH. 16. There is no other hospital in the area that we would be able to find all those 16 doctors.
10-year-old Braxton has a cyst on his brain down his spine and an autoimmune disorder treated through PCH, receiving IVIG treatment each month.
If he doesn't, he's super sick in the hospital.
Phoenix Children's Hospital, their providers and urgent care centers are now considered out of network for patients covered by Blue Cross Blue Shield, except emergency services, and certain patients may be able to receive transition of care benefits per PCH, still leaving the Harmon family looking elsewhere, considering treatment in another state.
Braxton, he doesn't like change in his health care. Now that he's older, he can realize things. He's comfortable with the doctors that he had, and it took him a really, really long time to get there.
It's time that PCH says they've had with Blue Cross Blue Shield to negotiate. PCH accusing Blue Cross Blue Shield of denying more than 10% of claims submitted by Phoenix Children's, and says they're asking for a reasonable increase to keep up with the cost of medical care and to align with industry standards. Blue Cross Blue Shield of Arizona telling 12 News PCH sent an offer to them earlier this week, which Blue Cross Blue Shield of Arizona says they accepted PCH's $80 million raise offer, but declined language changes, ending in no deal.
But the issue is really this, is that it can't come down to individuals who have children that need services where the fiscal obstacles get in the way of necessary care. And that's where I think it becomes very concerning.
Dr. Daniel Dirksen is the director of the Arizona Center for Rural Health at the University of Arizona, who says in some ways the news of no agreement is surprising, but
my guess is that Blue Cross Blue Shield and Phoenix Children's Hospital will work out their differences.
It took PCH and insurance company Aetna 2 months to reach a deal last year. Dirksen saying reform is needed.
What's needed is an accountability and better data on what is a reasonable benefit package, what's a reasonable rate, what's a reasonable charges versus payment rates. And I'd like to see more transparency.
While patients wait.
So they're just like putting us in the middle of this turmoil, which, put your profits aside and put the kids first.
Colleen Sikora, 12 News.